This is John. You'd like John. He's a good guy. A family man. A helpful neighbor. He's gone through life making solid, responsible decisions. He worked hard in school so he could get a good job, and he's been employed his whole life, all the while setting aside a comfortable amount of money so that when he retired a few years back, he knew he was covered. Then, John got sick. He had a hard time breathing. And John likes breathing. His doctor said he could continue breathing easy if he'd just take a certain medicine every day. But like most aging Americans, John's on Medicare. And when he gets to the pharmacy, he learns his copay is $500. And this is a regular, frequent copay. John's retired. He may be able to scrape together $500 today, but what about in a few weeks, or again after that? What does he do? Does he skip doses? Does he choose which of his medicines to hand back to the pharmacist, hoping he'll be okay? What other options are there? Sell his house, cut his food budget? Responsible, hardworking John seems to be out of good options. How does he breathe easy now? Now meet Gail. Gail is a hardworking career woman. She makes a good living, always with an eye towards the future when her children will be able to go to a good college. And maybe she and her husband will travel when they retire. There's a lot of the world she'd like to see. But Gail just learned she's experiencing some long odds, and not in a good way. She's got cancer, but not just any cancer, because her specific form is super rare, as in 1 in a million kind of rare. Her life-saving treatment is exorbitantly expensive, as in thousands of dollars a month expensive. Gail has a good job with decent insurance, but the cost of this cancer treatment is way higher than what her insurance covers, leaving some huge out-of-pocket costs. Now, what do Gail and her family do? Even if they live as frugally as possible, they'll tap out of their savings in a year? Maybe. So what does she choose? Skip treatment and hope for a miracle? Empty the tuition fund? I guess she'll have to let go of those dreams of seeing the world, too. John and Gail's stories are painfully sad. But do you know what's even worse? Their stories are not uncommon. This is happening every day, and you probably know someone who's wrestled with this exact insurance shortfall. In fact, as of 2016, 28% of adult Americans were underinsured. So what does it look like to be underinsured? Well, Americans with low incomes are by far the most at risk. In 2016, 44% were underinsured. For those keeping track, that's about 41 million people. These are our family members and neighbors, the single mom down the street, the staff at your local grocery store, grandmas and grandpas. These are people simply struggling to afford the out-of-pocket costs of their medical care. It's too easy for so many Americans to find themselves in this situation. Because you can plan all you want, but you can't always plan for unexpected medical issues. In the face of rising out-of-pocket costs, this is a seriously slippery financial slope for our underinsured neighbors. And if being sick, underinsured, and struggling to find a way to pay for your much-needed medicine isn't enough, every year in January, insurance deductibles reset, forcing people in this situation to pay as much as 40% of their medical costs in a single month. For people like John and Gail, this can mean facing bankruptcy. But luckily for our good friends Gail and John, and the 41 million people just like them, there's a solution: you. Because when you partner with PAN, you are standing with us in this insurance gap to bring men and women closer to the happy, healthy lives we all want. Because with your help, we can provide grants directly to John that never need to be paid back. With your help, we can work with the most vulnerable patients like Gail, who have life-threatening, chronic, and rare diseases. We've covered nearly 1 million underinsured patients on their rainy days, and have created nearly 70 disease-specific programs. But we know this is just a drop in the bucket, and we're constantly forming alliances with patient advocacy groups to fight for people who need this financial help. And together, we can help more people. When you stand with us, we see a future for this nation in which everyone can get the health care they need without sacrificing everything else in their life. So when you see someone like John or Gail in your life today, give them a hug, knowing when you stand with PAN, you're helping them live the happy, healthy life they deserve.